Good afternoon, everyone. Thank you so much for coming to our webinar today. I'm Caitlin Washburn. I'm the Health Beat Leader on Firearm Violence and Trauma for AHCJ. This webinar is one in a series of topic-specific training opportunities to brief health journalists on the latest information in a particular health area and to give you story ideas or story resources you can use in your work. Today's topic is on the medical community's responsibility in gun violence prevention. Gun suicides reached an all-time high in 2023, and almost 4% of gun-related deaths in the United States were unintentional shootings, the worst year on record for unintentional shootings by children. Firearms are also used in more than 3 out of 5 intimate partner homicides in the United States. Yet more than half of clinicians report that they avoid discussing firearm access and safety with patients because they don't feel equipped to do so or worry about alienating their patients. Joining us today will be Dr. Joseph Sakran. Dr. Sakran is a trauma surgeon at Johns Hopkins. He's also the chief medical officer for Brady United, a national gun violence prevention nonprofit. He himself is also a gun violence survivor. He's going to discuss how the medical community must overcome its reticence when talking about guns, take responsibility, and to prepare to have these difficult conversations. Dr. Sakran will present and we'll have a bit of a conversation and then we'll answer your questions. Just a couple quick housekeeping things. As questions come to you, please feel free to put them into the Q&A space on Zoom. Try to avoid using the chat. I'll check both places, but it's much easier on my end if you put your questions into the Q&A box. And then I'll be sure toward the end to direct your questions toward Dr. Sakran. So thank you so much for joining us today, Dr. Sakran.
Yeah, thanks so much for having me. It's a pleasure to be here.
Thank you. And I think to get us started, tell me about the This Is Our Lane campaign and how that came to be.
Yeah, so maybe just to kind of kind of put into perspective that I got into this. I'm a trauma surgeon, as you heard at Johns Hopkins. Really inspired to go into medicine um, and to become a trauma surgeon because at the age of 17, I was nearly killed after being shot in the throat with a 38 caliber bullet. And that path really kind of led me to becoming this trauma surgeon with the goal initially to really try to give other people the same second chance that I was given. And I think, Caitlin, what I realized as I was going down this path is that, despite how good, one may think they are as a trauma surgeon or even the Johns Hopkins Trauma Center, if someone comes in that's shot in the head, there's very little that I can do to bring them back to baseline. And it got me really thinking that the best medical treatment is often prevention.
Mm.
And as we started to kind of think about that as healthcare professionals and clinicians, there was a lot of emphasis that I was placing on how do we kind of get our voice heard beyond the bedside. And so I was really working at this nexus of medicine, public health, and public policy. And, to your question about This Is Our Lane and how it all came about, really this, campaign began in 2018 when the NRA told doctors to stay in their lane on gun violence. And as a trauma surgeon and as someone who has personally survived gun violence, I knew that this issue was already in our lane. Every day we see the devastating impact of firearm injuries in our trauma centers, in our operating rooms, and in the lives of our patients and their families. And I also knew that gun violence is not simply a criminal justice issue, it's a public health crisis, just like smoking and seatbelt safety. And like any public health crisis, it requires evidence based solutions beyond kind of, the human toll. It's also important to remember that firearm injuries also have an economic burden on our healthcare system. We did a study that was looking primarily at hospital costs that demonstrated a price tag of over $2.8 billion. And that doesn't even include the societal cost, which, some estimates have that at over $550 billion. But as you know, Caitlin, for clinicians, the cost isn't just financial, it's emotional and professional. We carry the weight of these tragedies. knowing that so many of them are preventable. And that's why Brady and the This Is Our Lane campaign that was incorporated and brought into Brady, which is the oldest gun violence prevention organization in America, is a essentially community of healthcare professionals that are dedicated to using our voices and expertise to reduce farm injuries and deaths. And through education, research, and advocacy, we equip clinicians with tools to talk to patients about firearm safety, suicide prevention, and things like responsible gun storage, because prevention starts in the spaces where trust and care already exist.
Wow. Thank you so much for walking us through that and kind of your background here. And I want to get into that a little bit more, this responsibility that clinicians have. Um, you spoke about your personal experience as well, and I'd love to hear more on kind of how you see this in your profession. But you know, there seems to be this disconnect that doctors recognize that this is a legitimate threat to their patients, whether it's in terms of suicide, or if it's in terms of their children at home, or if it's a pediatrician working with a parent, or even just the tragedy of an unintentional shooting of a gun being left out, locked and unlocked and loaded. But there seems to be this hesitation that happens where doctors don't quite know how to breach these conversations. They, kind of for a variety of reasons, whether it feels like, they're going to lose their patient, they're going to invalidate their trust in some way. But kind of talk us through like where doctors see their responsibility and then kind of where that breakdown happens in the when they're sitting down with their patients.
Yeah, I mean, I think it's a really important question because, as you point out, as healthcare professionals, we have a responsibility to talk about the risks that impact our patients' health and safety. And if you think about it, we already counsel patients on everything from wearing seatbelts and bike helmets to securing medications and household chemicals. But none of those are the number one cause of death for children and adolescents in the US. Gun-related injury are. And for those of us who work in trauma, the reality of firearm injuries is frankly impossible to ignore. I have stood in the operating room, fighting to save lives from gunshot wounds, and I've had to deliver heartbreaking news to families that their child that left that morning is never coming home again. Too often, unfortunately. And by the time the patients come through the doors, in many instances, it's already too late. And that's why kind of this focus on prevention is so key. The only way to reduce farm injury and deaths is to address gun safety proactively. And having these conversations with patients, just like we do with other public health risks, can make a real difference. Whether it's discussing secure firearm storage to protect children, whether it's recognizing suicide risk, or identifying individuals at risk of violence. These discussions can save lives. And as clinicians, that's what we're here to do. But in order to do that, right, we have to be prepared to be able to have those conversations. And you can imagine, Caitlin, that depending upon if you grew up with a firearm in the home, or if you grew up in southern Texas versus Boston, Massachusetts, right, those sociogeographic differences might make it comfortable or uncomfortable to have those conversations. And so that's why at Brady, we have been thinking about how do we objectively help and prepare, right, clinicians to be able to do that in a way that's non-judgmental. And that's what we're working on.
Yeah, I think that's a perfect segue into kind of digging into that resource. Part of why we're talking here today is because of the new resource guide that Brady has just unveiled for healthcare professionals that walks us through exactly this, how to navigate this issue with their patients. We're going to go through it in a little bit here, but I'm curious, where did the idea for this come from to build this specific resource guide? What work went into this? What sort of collaboration happened? Just kind of give me the backstory of this resource guide.
Yeah, I mean, so, the one thing that I think is so important about an organization like Brady, and as you mentioned, I serve as the chair of the board for Brady, but also the chief medical officer. The one thing that has been so critical is that, the way we look at this public health issue is that we have recognized that there is no one solution to this problem. And so that's why we work with veterans. It's why we work with gun owners. It's why we work with young people. It's why we work with every kind of sector to try and ensure that we are tailoring the solutions to the aspect of gun violence that communities are seeing, whether it's unintentional injuries from a firearm that was not appropriately secured to the violence that we see in cities like Baltimore. And part of those solutions are clinicians, right? We are in a unique position to intervene, and often that intervention starts with just a conversation. But despite the urgency, we knew, right, and know that more than half of clinicians don't discuss firearm safety with patients. Many feel unprepared, unsure of how to navigate the conversations, or worry about alienating patients. Yet the research tells us that patients, especially those in high risk situations like suicide prevention and domestic violence, are often open to those discussions when approached with care and respect. And that's why we created, Brady's This Is Our Lane resource guide. Initially, it's been distributed to over 300,000 healthcare professionals across all 50 states. And the guide provides evidence based best practices, scripted conversations tailored to different, patient scenarios, and additional resources to equip clinicians with the tools they need to have these life saving discussions. We know that prevention works, and we know that these conversations can make a real difference in protecting patients and their families. And Brady, we wanted to be able to provide that, to folks that were really reaching out, wanting to understand how better to do this in their own practices. And happy to kind of get into, some of the more details if that's of interest to
Yeah,
you and the
yeah.
people that are listening.
I think that's a perfect transition to get us into this. I'm going to pull it up now. And while I'm doing that, I want to remind folks tuning in that as questions come to you, feel free to put them into the Q&A section at the bottom of the Zoom screen. I'll be sure toward the end we'll make some time to get your questions to Dr. Sakran. But let's get into this guide. Okay, can you see it on your end?
Yeah, I can see it. Yep.
Okay. I think yeah, I first off, I'm a big fan of this. I think it's very practical. When I read through it, I found that there was a lot of it's just kind of chock full of practical tips, which is what I do all the time on this as much as I can on this page for journalists. And I think just like giving people like I like the I think I want to start with the kind of the do's and the don'ts.
Yeah. And by the way, as you start with that, let me just say
Yeah.
that was the whole idea. We wanted it, to be practical, to be just like something that people could like pick up and like say, okay, how do I use this? I mean, and that's the beauty of like the people that we have, I'm here talking to you, but there are so many people in addition to our advisory council that have spent a significant amount of time thinking about this, looking at this, from, JJ, our partnership manager, to people like Colleen Creighton, who works around suicide prevention. I mean, it required all of us to really kind of come together to figure out like how do we put together something that is practical for people to pick up and be able to use. And again, happy to kind of get into it and walk you through some of those aspects.
Yeah, yeah. If it's okay with you, I kind of want to start here with the our do and don't section, and I can
Yeah.
kind of just scroll through as you explain it and talk us through it, whatever works best for you.
Yeah, sure. So I think, look, one of the most valuable aspects of the this is our lane resource guide is that it provides healthcare folks with practical evidence-based strategies to navigate firearm safety discussions effectively. First, the guide emphasizes best practices for initiating these conversations in a non-judgmental, routine way, just like we do with other health and safety screenings. When we ask about seatbelt use or safe medication storage, it's not about politics. It's about preventing harm. The same approach applies to firearm safety. It also addresses common challenges that clinicians face, like patient discomfort or lack of confidence in approaching the topic, or even limited time during visits. The guide, is meant to offer these strategies to help clinicians overcome these barriers, ensuring that even a brief, conversation can be meaningful and productive.
Mm,
Another, key component of kind of the guide is the scenario-based guidance that is tailored to different patient populations. So, for example, the conversation, right, looks different when speaking with parents about safe storage in homes with children versus discussing, firearm access with an elderly patient experiencing cognitive decline. So it also, provides guidance for high risk situations, right, that we see like domestic violence or suicide prevention, where firearm access can significantly increase the risk of harm. And the guide reinforces the importance of safe firearm storage, highlighting, things like lock boxes and safes and other secure methods that reduce unintentional injuries and suicides. It also educates clinicians on the risk factors for firearm related harm, which we think is important, including, by the way, mental health crises, domestic violence, and introduces resources like the extreme risk protection orders, which some of you
mhm.
have probably heard of as red flag laws, and the hospital based violence intervention programs. The final, thing, Caitlin, that I'll say kind of about this from an overview perspective is that the guide underscores the critical role that healthcare professionals play in this space.
Mm.
Research shows that these conversations are, when they're framed as health and safety issues, patients are generally receptive. As clinicians, we have a unique opportunity to engage in these discussions in a way that is supportive, that's evidence based, and that ultimately is going to save lives.
Yeah, it's not so much about lecturing, it's about like I'm looking out for the health and safety of you and your family. I'm not trying to tell you how to live your life or what you're allowed and not allowed to do, but framing
Exactly.
that, yeah.
Yeah, there's this concept I think I hear a lot of times of like that, the people that are talking about gun violence prevention are trying to take away guns. This is not about taking away guns. This is about responsible gun ownership. And there's ways to do it in ways that kind of, blends the commonality that we have as Americans as we tackle this complex issue.
Mm, well said. So, are there parts you would like for me to highlight? I'm kind of toward the top here. You mentioned, I think it's great to have just explaining this, even and for the journalists on the call, which is most of us, but knowing yourself, knowing what safe storage means and what this looks like this is something that I had to learn on the job. I've seen these tools in person now myself and held them, and it's like it helps to know, it helps to have this. I think one point that y'all make in this guide at one point is the feeling like, oh, I'm not an expert on guns, so how can I talk about guns? It's kind of this basic familiarizing yourself with what tools are out there can kind of give you some confidence when talking about it. And if especially if a patient challenges you or like pushes back in any way, like, well, what do you know about
Yeah.
guns? You're just a doctor.
Yeah, well, exactly. And you don't, I think one of the things that kind of communicate to folks is that you don't have to be like a firearm expert to have, a conversation about this. I mean, I have had countless difficult conversations with patients and their families, particularly in the aftermath of firearm injuries. And these conversations are often raw, they're emotional, they're deeply personal, right? But they're also an opportunity to educate, an opportunity to prevent further harm, and an opportunity to engage in meaningful dialogue about gun safety. And so when I speak with patients, my approach is always rooted in respect and understanding. I try to ask open ended questions to understand their individual circumstances, whether they have firearms in the home, how are they stored, whether there are children or individuals at risk living in the household. My goal is never to judge folks, but to equip them with information that could save a life. And that's exactly, I think, why the resource guide, and you're pointing it out there, right, is so valuable because it provides clinicians with that structured approach in ways that are evidence-based to have these conversations across different patient scenarios. Again, like some of these can differ if you're talking to a parent with a young child versus uh, you know a family with an elderly patient who's experiencing cognitive decline. And the scripts, what they do is they help normalize the discussion, making it very clear that, farm safety is part of the overall health and risk assessment, just like the examples that we've given. And ultimately, the conversations are about harm reduction. And so, we believe, and I think a lot of healthcare professionals believe that it's our responsibility to engage, you know, with the same care and commitment that we would bring to any other public health issue. And if you want me to go through some examples, whether it's like for kids or for demented patients or whatever you think is useful, I'm happy to do that.
Yeah, I think one of the best when I read this myself, like to actually see a script written out, which no one's going to be able to stick to it or do it
Yeah,
exactly as is, but just to have the framework in your head when you're sitting down. And yeah, I actually think it would be helpful if we talk through some. You mentioned let's do the pediatrician one here. I'll go to that one now.
yeah, and I think you're making a really good point. Like that, we give people kind of a script so they can understand it back and forth, but it's not meant that they're necessarily going to be like, having to. It's to give them a framework, right? And when pediatricians talk to parents about firearm safety, the most important thing is to make it a routine part of the care. Again, just like the discussions that we've been talking about as it relates to, cars, seat safety, helmet use, securing medications. Again, it's just about keeping kids safe. And the risk of, unsecured firearms are real because research demonstrates that nearly 1 in 4 children have handled a gun in their home without their parents knowing. And right now, 4.6 million children live in homes with unlocked loaded firearms. And that easy access to firearm has devastating consequences. So, we know that access to a firearm can triple the risk of suicide. In 75% of youth firearm suicides, the gun was stored loaded and unlocked. And by the way, for school shootings, the numbers are just as concerning. Okay. There's like 76% of shooters under 18 that access their firearm from home or a relative's home. And 70 to 90% of guns used in unintentional shootings, school shootings, and youth suicide come from a home where a gun was not securely stored. So there is some good news, which is that safe storage works. And studies show that secure firearm storage could prevent up to 32% of youth suicides and unintentional gun deaths. And states with strong storage laws have a 78% lower rate of unintentional shootings by children, which is why pediatricians, right, and this script and conversation play such a crucial role in prevention, trying to encourage, parents to use things like lock boxes, safes, or other secure storage methods can be a simple step that saves lives. And when we frame it as routine, as health-based discussion, rather than a political issue, well, parents are more likely to be receptive. And for children, that can mean the difference between life and death. And that's what you're seeing in this script.
Yeah, I think, and to your point too, that you kind of treating it as like a rundown of just the different safety issues that it could be at risk for some with someone's child, and I think just kind of folding it in naturally, and it might not always feel supernatural to like bring it up if you've never brought it up before, but putting it in terms of like the medications and toxic products, like I think that makes a lot of sense. I think that's also disarming. Yeah.
Yeah, and it's one of the reasons that like there's a lot of different things that are happening. Like this guide is great. And this guide is one of like many different as we think about educational resources. Because what if it's the first time that you're doing it? Like, how do you prepare for that? So, we work with colleagues that are developing simulations that, help us, practice those type of things. So there's a lot of stuff that's being done in the space. But at Brady, we really wanted to provide this free guide for clinicians because we know people are asking for it and wanted to be able to do it in a way that provided them, as you said in the beginning, very practical information that you'll need to maybe pivot based off the scenario. Like, we were talking about a pediatric scenario, but what if you have a patient that underwent a traumatic injury, right? Well, how you engage in that conversation could be different. And you have to understand that, you know, from a background perspective, individuals who, let's say, survive a firearm injury are significantly higher risk for re-injury or death from gun violence, whether it's due to retaliation, unsafe storage, or self-harm. And in fact, the research shows that nearly 1 in 5 survivors of firearm injury will be shot again within 5 years. And sometimes that number is even higher depending upon where you live. And so, you know, clinicians that are approaching those conversations, we emphasize doing that with empathy and understanding, recognizing that firearm ownership and access may be deeply personal. And we try to do it in ways that uh, are open-ended and non-judgmental. So for example, hey, can we talk about your safety moving forward? Do you have concerns? Do you currently have access to a firearm? If you do, would you be open to discussing ways to safely, store it in order to reduce the risk of future injury? And, depending upon the patient's circumstances, the conversation may focus on different aspects of risk reduction. For patients at risk of retaliation, maybe connecting them with our hospital-based violence intervention programs that can, provide support and conflict mediation and resources to reduce re-injury risk, maybe for patients that are recovering from a self-inflicted injury or those struggling from mental health issues that we discuss temporary firearm removal or access to resources like the extreme risk protection orders that we mentioned. So many of these patients, are open to these conversations when approached in a supportive and non-punitive way. And that's what I continue to come back to because I think we sometimes forget that. The goal isn't to tell someone what to do, it's to equip them with the information and the resources they need to make a safer choice. And ultimately, we believe that these conversations can save lives.
Oh, well, really well said, doctor. I think it's what as you were talking, and then I realized it's even in the script, and you mentioned it yourself, but hospital-based violence intervention programs I'm familiar with, and but I think could you kind of talk us through those and how that kind of existing framework for intervention and just having these conversations, both with patients, but especially with their family and loved ones. Like I know a lot of these conversations will happen in the immediate aftermath of a shooting, especially to prevent retaliatory violence in any way and to make sure they're safe in those immediate days and weeks after the fact. So can you explain for our listeners like what is a hospital violence intervention program and how that informed, especially this trauma follow-up bit?
Yeah, sure. Happy to do that. So, hospital-based violence intervention programs are multidisciplinary, initiatives that are essentially designed to address this revolving door and revolving cycle of violence by providing comprehensive support to individuals that have suffered violent injuries. So at Johns Hopkins, our program is called Break the Cycle. And these programs integrate medical treatment with community-based resources to tackle the underlying factors that contribute to violence. So key components of these programs can be the first is immediate intervention, meaning specialists, right, that have lived experience engage with patients during their hospital stay, capitalizing on what we call a teachable moment, when individuals may be more open to positive change. The second are things like ensuring there's comprehensive care that's provided following discharge. So patients receive long-term care, term case management, that may include services such as safety planning and mental health support and employee assistance and even educational opportunities. And then there's also a community collaboration, right, component where HVIPs collaborate with local organizations to ensure culturally competent care, leveraging the expertise of professionals familiar with the communities that they serve. And research, indicates that these programs can significantly reduce rates of re-injury and criminal activity among participants, while also alleviating healthcare costs that are associated with recurrent violent injuries. And so it's something that, we think is very valuable, which is why we invest in it and why we partner with, the mayor's office to be able to do it in a way that is effective across the city.
Thank you. I think that's really important, and that's presents an opportunity for coverage too for journalists, the healthcare journalists especially, that there are the ways, especially that the medical community is tied to gun violence prevention. So I thank you for talking us through that. I think that's very important for people to understand. I do have a couple more questions for you kind of after we go through the guide, but I want to make sure that we were able to hit on some of the other points here. I think um like you said that this conversation is tailored to the patient, to the scenario as well. And I think the point about domestic violence too, and even just I mean, I can think in my own doctor's office visits where I'm asked about like if I feel safe at home or like I don't think I've actually been asked about guns before, but I'm hopeful that I will one day. But I've definitely been asked about mental health, my own mental health, like for as far as like the line of questioning when it comes to suicide, but then also feeling safe in my relationships. Can
Yeah.
you kind of talk through, I mean, I know there's training here for this, but when those like red flag things come up when a doctor's in a situation where kind of they hear their patient mention something, whether it has to do with mental health or has to do with domestic violence, like and then kind of what's the advice? How do they then navigate that if they, if they hear something alarming, if the patient makes mention of something that they've experienced at home or something going on with them mentally.
Yeah. I mean, I think like it's one of the things that just very important to consider is that there may be scenarios, right, where clinicians are concerned about what they're hearing or patients communicate something that the clinician may or may not be comfortable in tackling, right? It's one of the reasons that we created this guide. It's to be able to empower clinicians with the knowledge and the ability to be able to address some of these things. And depending upon, the kind of conversation and what's being brought to the forefront, there are a lot of different ways that clinicians respond to some of the things that they're hearing. When they're concerned about things like mental health, it would really depend on the program, the environment, and the situation that they're in. I can tell you at Johns Hopkins, we have a very robust group of mental health professionals that assist us in trying to navigate some of these different complex areas. And so clinicians shouldn't feel like they are necessarily alone or feel embarrassed by not necessarily knowing how to tackle a certain kind of problem or issue. They need to be able to lean on the resources and kind of the community they have within their own setting. And that can be variable, depending upon if you're at a place like Hopkins or if you're, somewhere where perhaps they don't have an extensive amount of resources. And I think, just to kind of bring this all together, as I think about, ultimately um, the type of things that we're seeing and why I thought this conversation with you and the other journalists is so important is because I think this doesn't often get covered enough where people are really starting to understand why prevention matters. And if I can, I would just say that the biggest takeaway from this guide is that gun violence is a public health crisis, and we have to start approaching it the way we have done with other public health issues like tobacco and motor vehicle crashes, right? The healthcare professionals, the clinicians are uniquely positioned to intervene. And I think that normalizing these conversations, I mean, you yourself said you've really essentially never been asked about it. If we normalize these conversations about gun safety in a clinical setting, then we're going to be able to save lives. And for healthcare journalists, we need more stories that highlight why prevention matters and what does successful prevention look like. Too often the coverage of gun violence is focused solely on tragedy, on the aftermath, but we need to also highlight the solutions and real world impact of prevention efforts. And that's why I'm so appreciative that you guys are covering this. And it also means that featuring, like healthcare professionals who are having these life saving conversations, survivors that can speak to the importance of interventions, and other public health experts that can provide data on why this matters. At Brady, we have seen prevention work in action. I think about our End Family Fire campaign, which focuses on preventing family fire through safe gun storage. We have found that gun owners aware of the campaign are more than 4 times as likely to seek out safe storage tips. And that's the kind of stories, Caitlin, that we need more of. Examples of proactive, evidence-based solutions that are already making a difference. And I think, yourself and other journalists have a powerful role to play in shifting the narrative of gun violence by focusing not just on the problem, but on the prevention strategies at work and how they can help change those conversations and ultimately save lives.
Really well said. And you took the question right out of my mouth, which is what should our reporters be taking away from this as far as story ideas? And
Sorry, I got ahead of you.
no, don't never apologize. Are you kidding me? That's great. I'm glad you were already where I was thinking. And I think it's also a good point to move to some of the questions we've had coming in. We've have some really thoughtful and great questions here. So I'm going to start with one. What are the steps to build trust with gun owners? Did gun owners contribute to this guide, and how did that affect its contents?
That is a great question. So we do have gun owners that are part of the Brady movement. Like I mentioned, at Brady, we engage with every sector because we think that's important. I think when you think about um, the key word in that question, I can't see the question, but I think I heard you say trust.
Mm.
And trust is such a critical piece of this. And I think trust with gun owners involves respectful dialogue, shared understanding, and collaboration. And I think here are some steps that can foster trust. The first is engaging in the respectful conversations, and maybe, the tough conversations that need to be had by approaching the discussions around firearms with empathy and without judgment. So, use like, I statements to express your views, such as I feel or I believe, to avoid making others feel attacked, right? No one wants to feel attacked. And that approach I found often opens dialogues and allows for kind of the mutual respect that's required. I think also like highlighting like what are the shared values and the commonalities that bring us together, emphasizing these common goals, and we talked a little bit about that, like safety and responsible ownership and even protection of rights. I think if we recognize these shared values, it can allow us to bridge the type of divide and build the type of rapport we want to see. Um, I think promoting education and training is also another piece, like encouraging participation in firearm safety courses and training programs and collaborative learning experience that can enhance that mutual understanding and demonstrate this commitment to responsible ownership is so critical. So those are some of the things that I like to see and that we like to practice to be able to understand where people maybe with different vantage points are coming from so we can figure out like where can we build off of those scenarios and move forward together to make communities safer, because at the end of the day I don't think anyone, right, wants to see a child being shot and killed. I think the differences kind of lie, and the ideological differences kind of lie in how you get there, if that makes sense.
Oh, absolutely. I think you made a really good point that I think is often missing from coverage, especially coverage of owners, which if I have a big critique of how we write about gun violence is we don't give there's so much focus on the more extreme voices in the gun owner community. And I think that, and I've read plenty of surveys that show that there are a lot of people who are very realistic and are aware of the safety and like will say, yes, safety training should be required or that should be something that people do. They should practice safe storage. So I think that that's always an important thing to highlight that, there are a lot of reasonable people out there who are aware of the risks and the lethality of having a weapon in their home. We have two really good questions that I'm going to combine, and I'm going to go back to the guide for them because I think it's a great point. They're along the lines of older adults, especially patients with dementia, and kind of one question is asking specifically about having this conversation with caregivers and how do you safely have that conversation about preparing to take away a firearm. And another makes the point that, what kind of a more broad question about older adults with disabilities, but also with dementia. And I know that there is a script for this in the guide, so I'm going to pull that up while you answer it.
Yeah, no, thanks. It's such an important question, and it's really hard to talk about because, I mean, I have aging parents, and as aging parents, they can sometimes be a little bit stubborn, and they have their own thoughts and ideas, and it's a fine balance. I think when clinicians talk to families about firearm safety for a loved one with dementia, as the example that you gave, it's important to frame the conversation as part of the overall safety planning, just like discussion of driving or the medications or fall risks and so forth. And as dementia progresses, cognitive decline can lead to confusion and impaired judgment and changes in behavior, which of course can increase the risk of unintentional harm. And in fact, studies show that people with dementia are at higher risk of firearm related injuries, including unintentional shootings and suicides. So, in some cases, individuals experiencing paranoia or agitation have used firearms against caregivers or family members, mistaking them for intruders, right? So, the goal for clinicians, I think, is to proactively address these risks before they become a crisis. That means, again, having an open, non judgmental conversation with the family members and caregivers about safe firearm storage, or in some cases, as part of your question, the need to remove firearms from the home altogether. I think key recommendations include, storing the firearm securely in a lock safe or lock box with ammunition stored separately, using, of course, gun locks or disabling firearms to prevent unintended use, having a family plan in place, similar to conversations about driving restriction, to gradually transition, firearm access as cognitive abilities decline. And then exploring, the legal options when necessary of things like extreme risk protection orders in states where they're available, which can temporarily remove firearms from individuals at risk of harming themselves or others. Many families may not immediately recognize the risk, which is why it is crucial for clinicians to initiate these discussions early and to make them part of the standard as we talk about dementia care planning. Just like, you would take away car keys at the right time that we know can prevent tragedy, addressing the farm safety in a compassionate way, but in a way that's proactive, can save lives.
Thank you so much. I think that that's a really important part of this conversation too. And especially, yeah, I mean, I know in navigating that can't be easy. I can think of with my own family, especially the car issue. But it's important to, like you said, have these be non-judgmental and be just, framing it around safety, I think is so important. I I got one question here I'm going to amend a little bit. It's, do you have any success stories of physicians who have used this guide with patients? And I know since this guide is brand new, you might not know of any yet, but can you think of any success stories as far as using the principles of this guide, as far as what, kind of the ethos behind it, this idea of having these conversations about guns, and exactly as we've been talking about for the last 48 minutes.
Yeah. Well, here's what I'd say is like, specifically to this guide, I think it's too early, right? Because we're in the process of rolling it out. But I think the principles that underline this guide, right, where, we clearly know that these conversations are important and crucial. The thing about success stories is really interesting is like you don't often hear about, the child that wasn't shot because, right, it never happened. And so that never really makes the news. But what I have seen and what's been demonstrated in talking to a lot of pediatricians, other types of clinicians, is they're getting parents that are saying, "Hey, now when my kid goes over to the neighbor's house to play, I also ask, do they have firearms around?" And it's very interesting because while it's still early, we're starting to see a shift in kind of the culture of how parents and others approach this, which then brings me back to kind of the principles that are in a guide like this. That, it's because we're starting to have those conversations that then kind of permeate and filter down to parents and family members, where they're now starting to have this in a way that I think is very meaningful. It's hard to like really kind of pinpoint that impact, right? Because there's so many indirects and aspects of it. But I think it's important to notice that there is more of an interest and I think comfort in even not just the clinicians having the conversation, but the parents and family members having those tough discussions. Because it used to be that, oh, like we can't ask about that, you know, you ask if your kid has a peanut allergy, you're going to ask the mom and dad, "Hey, my kid has a peanut allergy. Like, you guys have any peanuts there? Please, right?" So we're normalizing those conversations and changing that culture.
That's really well said, and I think that's a great place for us to wrap up here. Dr. Sakran, this has been such a wonderful discussion, and I'm grateful for the chance to learn more about this guide and the effort that went into it. And I think I can see lots of opportunities for healthcare journalists to be covering this and to be maybe finding some of these success stories, so that the medical community is also aware that this works and that this helps save lives. Um, Thank you all for everyone who's tuned in today and for your very thoughtful questions. If you join us late, you will be able to find this webinar at healthjournalism.org in just a few hours. We'll also include a link to the guide as well. And once again, I want to thank Dr. Sakran for taking time to share your expertise. AHCJ will continue to bring you webinars on a variety of health topics as a perk of your membership. Thank you for joining us today and good luck on your stories.
Thanks
Thank you.
so much for having me, Kaylin. It's a pleasure to be with you all.
Thank you so much. Take care.